Adjournment. We will recommence the debate. Danny Kruger.
Thank you very much indeed, Madam Deputy Speaker. It's a pleasure to follow the honourable member for Oldham East and Saddleworth in her speech. She's a great champion of this cause, and I'm very proud to work with her on the APPG for prescribed drug dependency, which I'm going to ask her to co-chair with me after this debate. I also want to just call the House's attention and Hansard's attention to the speech made by the honourable member for Bermondsey and Old Southwark, the most distressing and powerful story he told of a constituent of his, and I think that story will remain with me as a terrible example of the state of so many of our constituents and of mental health services that don't work properly. I welcome the debate, and I'm afraid to say I do recognise many of the descriptions given by members on all sides. I do want to call attention to the very excellent services provided in my constituency of Devizes by the Green Lane Hospital, a mental health hospital there that's been there for many, many years. But even there you have many cases in which constituents feel that they've been let down and of genuine difficulty of accessing the services that are needed in time. So despite the good efforts made from the top of the system to the bottom, we simply aren't doing well enough. So I welcome the debate. I recognise the general point that's being made, and of course I agree with the argument put forward by the opposition that we need more mental health services. The question is what those services should be and how they're organised, and indeed, Madam Deputy Speaker, whether we should use services as the frame for this whole debate. I wonder whether the term services and relationships would be more appropriate, and members have mentioned the primacy of relationships. The fact is we don't fully understand all the neurological origins of mental health conditions, but we do know that they are exacerbated by social circumstances, and that while medical treatment can help, what really helps is good relationships. And I know this from my own experience. For many years I ran a project working in prisons and with ex-offenders, and you saw so clearly there that while of course the official and the essential responsibility for crime and criminality rests with the individual, it is usually relationships and relational skills, or the lack of them, that lead somebody into crime and into prison. And it's relationships and relational capacity and skills that helps people to get out of an offending lifestyle. We know this very well from all the evidence into studies on addiction, very closely correlated to mental health. So what do we do? Well, there's a consensus that we need more services and we need better services, but my concern is that we end up focusing the system's efforts on quantifiable measures, quantifiable inputs, most of all the prescription of pills, of pharmaceutical treatments, and so we end up medicalising mental health just as we medicalise so much physical health as well. And I chair the APPG, as I mentioned, on prescribed drug dependency. The research that the APPG has supported, particularly by Dr. James Davis from Oxford University, shows that a fifth of adults are on antidepressants. Many of them because they can't get off these pills, even though they're only supposed to be prescribed for a certain amount of time. We spend £500 million a year on prescriptions for medication that people should not be on, according to the guidance for those pills. So I worry about the trend towards a medicalisation of mental health, and I particularly worry about the major condition strategy, which I welcome from the government. We can't have just a focus on pharmaceuticals. We have got to make it much wider, so not just about services, but about the relationships that support good mental health. I'm pleased there is a strategy on mental health. There does need to be top-down action. I would like this to also focus on undoing this over-medical model. We need more training for GPs to understand the social relationships that are at the heart of mental health, including how to support people who have acute conditions. More funding for social prescribing, which has been mentioned, which is a tremendous initiative. Support for withdrawal services, and a helpline for people who are addicted to prescribed drugs. Overall, we need a bottom-up approach, though. And so I respect Labour's plan for more access hubs for mental health, more school mental health workers, more staff. But really, we need system reform. And the Honourable Lady on the front bench mentioned a community mental health approach. I like that phrase, but I think that includes much more than just more hubs and more staff. We need whole system reform, which prioritises the civil society organisations, the families, and the community groups that have such a powerful role to play in supporting people with mental health. And I'd lastly draw attention to the whole model of the new developing model called outcomes partnerships, whereby the public sector pays for results, not for inputs, not even for outputs, but for actual demonstrable improvement in whether it's healthcare or mental health, which brings together all the different providers from civil society and the public sector, and indeed businesses, mentioned the importance of workplace training, so that we get all the different players involved in a person's life and the funding is more local and it can be used on that preventative agenda, which is so important, rather than just trying to pour more money into the top of the NHS and thinking that that's going to work. We need to fund from the bottom up. Thank you.
Thank you. I need to